Welcome to Mulready Minutes with Oklahoma Insurance Commissioner Glenn Mulready. This is a podcast about insurance for insurance folks, risk managers, and business leaders. We'll dive deep, examine what is and isn't working, talk to leaders in the industry, and keep you informed on what's happening in Oklahoma and around the country.
Hi, Oklahoma Insurance Commissioner Glenn Mulready here, and today's episode in the Mulready Minute podcast has to do with open enrollment in our Medicare space. And so it's that time of year. In fact, we're a couple weeks into it at this point. So we have as our guest Ray Walker with the Oklahoma Insurance Department. So Ray, would you give a quick intro of yourself?
Thank you. I'm the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. I've been there about 15 years. Our division at the Insurance Department is funded by grants from the Administration for Community Living that give us funds to help people with anything having to do with Medicare. If they've got questions about their Medicare coverage or what options are available to them, that's what we're there to help people with. So we help Oklahomans with any of those questions they've got about what their options are, questions, concerns they may have about what's available out there.
Got it. Yeah. So your area is funded by federal grants as opposed to really the rest of our operation at the department. But so Ray, October 15th, open enrollment for Medicare stuff kicked off. Ends, I believe, December 7th.
Yes, sir.
So what kind of decisions are folks making? What should they be thinking about?
This is a great time of year for everybody, regardless of what your Medicare coverage is, to be thinking about what is covering you for your healthcare needs, as well as your prescription drug needs. Because even if you've currently got retiree coverage, maybe that retiree coverage is getting kind of expensive, or maybe you just want to evaluate, is it covering all of your healthcare needs? So this is a great time of year for everybody to kind of stop and evaluate what's covering me for my healthcare needs. Maybe you've got VA coverage, maybe you've got coverage through the military, like TRICARE coverage, or other things. So we want to make sure that everybody is looking at what their total universe of healthcare coverage is and identifying, are there any spots that they might need to fill in? Maybe those coverage needs that they've got are some other kind of private coverage, like a Medicare supplement plan or a Medicare Advantage plan or Part D prescription drug coverage. And that's where we can kind of step in with our staff to help them identify what are the options that are out there, what are the gaps that might be existing that they need to fill in. And we can help them compare what those different options are and identify what are the costs associated with that coverage and help them kind of decide what they might want to purchase.
Yeah. I'm glad you mentioned the different products because there is, someone hears Medicare, they think that's sort of one thing, but there is not now with what we've got. Also, in this past year, I personally have been receiving an onslaught of mailers and calls and emails. Not sure why, because, I'm 10 years away from having to do Medicare, right? But it really, I wish I had saved those all. I really am kicking myself that I hadn't saved all those so I could bring those in to your team to show the stack of, and just how confusing.
They make great confetti.
How confusing that can be. Do you have any sort of red flags, or is your advice just to contact your folks immediately with questions?
It's unfortunate that once you turn 64 around that time frame, not that you did, but once you get around that time period, you do start getting all sorts of mail, and not just in the mailbox. Nowadays with social media and stuff, our seniors are just getting a deluge of information constantly about this plan and that option and this different drug plan and stuff. And what we tell people is, if you're interested, if you want to know more about that, by all means, read that mail or look at that option and stuff. But if you do, make sure that you read it very, very carefully. Don't just go for the large print. Read down to the fine print. Research this information very, very carefully before you make any decisions. We don't want anyone to get into a product that might in some way do more harm than it does good. For example, if you do currently have some sort of coverage. Maybe it's a retiree plan through your previous employer. Sometimes if you were to add some additional coverage, maybe it's a prescription drug plan, enrolling in that plan might accidentally cancel your retiree coverage, and you never intended to do that. So we want to make sure that people understand what the consequences of taking some of those actions are. So again, that's another opportunity where maybe we can help you decide whether or not that's something that you want to do.
Yeah. And I think to your point, someone's been happy with their plan. They may think, well, I don't need to do anything. I've been happy. However, this is the time to pay attention, really, because I know what we're seeing is quite a bit of provider network changes, right?
Yes.
Certain hospital that is no longer going to take a certain Medicare Advantage plan, or maybe you've got a new prescription you've just changed into, and your coverage under your drug coverage is different now. So it really is the evaluation time.
Exactly. Even if nothing has changed, you may have had a Part D prescription drug plan that you've been on that worked really, really great, and you were happy with it. Nothing seems to, why bother with it? Things can still change from year to year. The monthly premium for your plan that you were on last year might have changed. Also, the copays that you might have to pay for your prescriptions could be going up. They may have not continued to cover a prescription medication in the coming year that they covered last year. As you said, maybe you've got a new prescription medication that your doctor has added to your regimen. So it's always a good idea to go ahead and compare what drug plans are going to be available in the coming year. Last year, we had 17 different Part D prescription drug plans that were available. Next year, we've only got 11. So there's a lot of people out there whose Part D plan isn't even going to be available next year. So we're assisting those people with choosing a new plan that's going to be able to give them their prescription medications at the best possible price. So it's always a great idea just to compare. If you don't want to change, you don't have to change. Nobody says you have to, but at least you've gone into it knowing what you're getting into. Then you also mentioned about the network changes and how frustrating that can be for people. There's a couple of things that I'm hoping are going to make people feel a little bit more comfortable in the coming year. As it relates to your Part D prescription drug plan, at the beginning of the year, the Part D prescription drug plans are required to establish what their formulary, that's the list of prescription medications they're going to cover, that's got to be established at the beginning of the year. So those drugs are going to stay on that formulary unless for some reason they're found to be unsafe. Then they're going to come off of everybody's formulary. But as far as the provider network goes, as of this year, CMS now requires that any of the Medicare Advantage plans are required to submit their contracted network to CMS. And that information is now found on Medicare.gov. So when people are looking on Medicare.gov on the tool that we refer to as Plan Finder, they can not only enter their prescription medications and the pharmacy that they want to use, they can also enter the providers that are important to them to continue seeing. So if you've got a cardiologist that it's important that you continue seeing, or some other provider, a neurologist or something like that, you can enter that information in and it'll tell you if that provider is or is not contracted with that particular plan. So that's a huge help for a lot of people. We still tell people, even if that Plan Finder tool says, yes, that provider is contracted with that plan, it's always a good idea to have a conversation with that provider as well. Yeah. You want to determine, is that provider not only contracted with a plan, but do they plan on continuing to be contracted with that plan? Relationships can sometimes get tedious. Sometimes this is a business relationship, and providers don't necessarily have to stay with that plan for the full year. If they've got some issues that they're dealing with, we don't want you to get enrolled into a Medicare Advantage plan and then halfway through the year, the provider may leave. You may not be able to. So discuss it with your provider and see what their feelings are about you getting enrolled in a particular Medicare Advantage plan. Now, if you're on a Medicare Supplement plan, that's a different situation. Medicare Supplement plans have always been where if you're seeing a provider who accepts Medicare, they're going to accept your Medicare Supplement insurance.
Yeah. This is a good time to mention a couple of things. I think, a bit of a point of frustration with me as well as other insurance commissioners around the country. We've been advocating for years that we don't have authority with Medicare Advantage plans. We oversee their licensing and we oversee their solvency, and so it's real frustrating. I know for years now, going to D.C. each year and advocating that, hey, we want Oklahomans taking care of Oklahomans. We need some authority. Allow us to enter a collaborative agreement with Medicare, that type thing. So hopefully there'll be some changes there. But just so folks know, it is a little bit different with the different products. Our authority there and has been a bit of frustration. Also, in our previous program, talking about individual health insurance, we talked a lot about rising healthcare costs. Mm-hmm. And I know what we're seeing on the Medicare supplement side is rising premiums due to just that medical trend, those rising healthcare costs. So I know that is happening as well in that Medicare supplement program. We have implemented something, we call it the birthday rule, that has allowed folks to make some changes within that. And it's been very well received by, I know, agents, brokers, and consumers out there. But any comments or thoughts on any of that? Yeah,
it's pretty exciting. Prior to 2023, one of the things that was probably the most heartbreaking for us was for our seniors who have been on Medicare supplement insurance for many, many years. And the great thing about a Medicare supplement plan, as we said, was anywhere you go in the country, they will accept your Medicare supplement if they're a Medicare provider. Now, with Medicare supplement insurance, once you purchase your policy, when you first become eligible for Medicare, you can purchase any supplement policy that's available in your state. They can't charge you any more because of any current or pre-existing health condition. It's a great time to buy a Medicare supplement policy. You get a great deal. However, as time goes on, as we get older and we start having some health problems and things like that, maybe you develop a heart condition or your diabetes gets worse or something like this, it's not very easy to be able to switch to a different Medicare supplement policy if the prices start going up on your Medicare supplement or something, because now those same companies can start making you health qualify. They can start looking at that health history. And so consequently, we had a lot of seniors who were pretty much trapped in their Medicare supplement policy. And so we had a number of seniors who were paying in excess of $400, $500, $600 a month for their Medicare supplement policy. So toward the end of 2023, Oklahoma passed the birthday rule. And what that allows is for our Medicare beneficiaries who are currently on a Medicare supplement policy, they can now, on the month of their birthday, actually it's the date of their birthday, it starts a 60-day period during which they can shop for and purchase any Medicare supplement policy with equal or fewer benefits. They can shop for and purchase that Medicare supplement policy, and they cannot be denied that policy because of any current or pre-existing health conditions. It's basically like a get-out-of-jail-free card. And we have had so many seniors who have been able to stay on their Medicare supplement insurance as opposed to the alternative, which for them was going to be having to get off of their Medicare supplement and get onto a Medicare Advantage plan or just go to traditional Medicare. And so these people have now been able to increase their the quality of their life, because now they can take that extra money that they were having to spend on those excess premiums and apply it to other things like the cost of living, food, fuel, housing, and things like that.
Homeowners insurance.
The story of the homeowners insurance. Unfortunately. But I mean, we've heard some really great stories about how this birthday rule has changed people's lives and saved them this kind of money. And this is not just for people who bought their policies here in Oklahoma, people who lived in other states and purchased their Medicare supplement policies in other states and that have moved here. They too have had this same savings that has been such a tremendous impact on how they live their lives. So the birthday rule has been really great. I get a lot of questions from my counterparts in other states about our birthday rule, and it's been really, really great.
Good. That's really good to hear. I hate to shift and kind of wrap up on a negative note, but I'm going to. And that is at this time of year, and given the demographic, often there's some bad actors out there. Mm-hmm. There's scams and misleading marketing materials and all kinds of other benefits available to you. Any thoughts or warnings for folks, and they're looking at that, what they can look out for?
Yeah, it's sad that this goes on an annual basis. It's not just at this time of year, but boy, does it get really bad this time of year. Yeah. People are getting a lot of phone calls from people claiming to be representing insurance companies, claiming to be representing the government. We always encourage people, number one, if you get a phone call and you don't recognize the number, don't answer the call. If it's an important call, they'll leave a message. Don't even push the little button on the side of your phone that says, that stops the phone from ringing. Experts will tell you that still tells them that it's a good phone number.
Line, yeah.
So leave that one alone. Don't respond to mailers and things like that. Emails. Don't push the button that says click here for more information, because you really don't know what that button actually means in your computer system. It could be giving somebody access to more information. The best thing to do is if you feel like you're getting a phone call from someone who claims to be from Medicare or from Social Security saying that your account has been compromised, hang up the phone or disconnect and call on a number that you actually know is to that particular party. For instance, if they claim to be from Medicare, hang up the phone and call 1-800-MEDICARE. If they claim to be from Social Security, disconnect and call a phone number that you know goes to Social Security. Don't assume those people are who they claim to be, because most of the time it is going to be a scam. By and large, these entities are not going to contact you by telephone or by email. They're going to send you something through the mail.
Yeah.
So just be vigilant.
Yeah, good. That's a good word. Be vigilant. Well, Ray, thank you for being with us. I will just reiterate here. Questions, Medicare.gov, October 15th to December 7th is your window of time. If you have questions, you need some unbiased advice from the Oklahoma Insurance Department, contact us, oid.ok.gov, or also 1-800-763-2828. So that wraps up our enrollment conversation on Medicare. Ray, thanks for being with us.
Thank you.
Yeah.
If you found this episode informative, please subscribe and share with your colleagues. Visit oid.ok.gov/podcast. Let us know what topics you would like to hear about. Until next time, take care from the Oklahoma Insurance Department.